Okay, welcome. Good morning, everyone, and thank you for joining us on this call today to discuss the release of the Cancer-Free Economy Network's joint statement on cancer prevention, titled Cancer and Health Leaders Call for Action to Reduce the Burden of Cancer by Addressing Environmental Risk Factors. I am Nsaidu Obot-Witherspoon, the Executive Director of the Children's Environmental Health Network and co-chair of the Health Science Node of the Cancer-Free Economy Network. The creation of the joint statement has been led by the Cancer-Free Economy Network and supported by key health professional, public health, and cancer-focused organizations. For those that don't know, the Cancer-Free Economy Network is a dynamic collaborative network working with diverse teams of experts and stakeholders from a variety of multi-sector areas, including environmental health, research, social science, policy, legal, labor, business, and communication sectors, to name a few. We've all come together to accelerate the progress towards a society that values healthy communities above profit. We are organized around the principles that we believe the water that we drink, the air that we breathe, the food that we eat, the products we use, and the places where we live, learn, work, and play should not make us sick. Yet scientists are increasingly learning how chemicals in our everyday lives contribute to the development of cancer. While we continue to work on finding a cure, we can also act now to prevent some cancers as well as other diseases. By replacing the most harmful cancer-causing chemicals with safer alternatives, we can create healthier homes, learning environments, workplaces, communities, futures for ourselves, our loved ones, and for future generations. The Cancer-Free Economy Network is seeking solutions that are broader and deeper than what we as individuals or organizations can accomplish on our own. Our strategies are derived from an in-depth analysis of the system that has created an economy that depends on hazardous chemicals. This process has led us to a common goal where we are working to, within our generation, lift up the burden of cancer and other diseases by driving a dramatic and equitable transition from toxic substances in our lives, our communities, and our economy to safer and healthier alternatives for all. We have known for decades that some populations are particularly vulnerable. Research shows that Indigenous, Black, and Latinx people are, as well as recent immigrants, and those with lower incomes are far more likely to work with toxic chemicals that increase their risk for cancer and are more likely to eat, drink, and breathe more toxic chemicals because of where they live. Children also are especially susceptible and vulnerable to environmental chemicals because of their developing bodies and their behaviors. Their young age also means that they have more time to develop diseases with long latency periods, such as cancer that may be triggered by harmful exposures early in life. Just to name a few of the science linkages to long-term illness such as cancer that is called out in this joint report based on science. The use of pesticides in agriculture on playing fields at schools and in residential spaces has been linked with an increased risk of childhood cancers, including leukemia and lymphoma. Organic solvents such as benzene are potent carcinogens associated with leukemia, non-Hodgkin's lymphoma, and multiple myeloma. These solvents are present in the life cycle of a wide range of industrial processes, from the extraction of fossil fuels to traffic-related air pollution. And air pollutants such as polycyclic aromatic hydrocarbons have been shown to increase the risk of lung, bladder, liver, mammary gland, and other tumor types. All of these that I've mentioned are actually linked and talked about as well in a childhood cancer prevention report that will be released next week, September 23rd. And for breast cancer alone, more than 200 chemicals have been associated with mammary gland tumors in animal studies, and about half of these are chemicals that women are routinely exposed to in their common everyday lives. This first ever joint statement on cancer prevention was created to align key trusted messengers in the healthcare, public health, and cancer-focused arenas to amplify the growing science in the field and accelerate opportunities for prevention, not just treatment of disease. We are very pleased to have the following esteemed leaders join us on this call and release today. Our first speaker will be Dr. Margaret Kripke, Professor Emerita and Founding Chair of the Department of Immunology at the University of Texas, MD Anderson Cancer Center, where she also served as Executive Vice President and Chief Academic Officer. Dr. Kripke also served multiple terms on the three-person presidential cancer panel, which oversees the development and implementation of the National Cancer Program. She served on that panel and produced the path-breaking 2009 report, Reducing Environmental Cancer Risk, What We Can Do Now, which alerted the nation to the enormous potential for reducing the nation's cancer burden by preventing environmental cancers. Our second speaker will be Jonathan Egan, who's the executive director for the Max Cure Foundation and co-founder of the Children's Cancer Therapy Development Institute, a nonprofit childhood cancer research biotech located in Beaverton, Oregon. Jonathan serves on the National Cancer Institute Brain Malignancy Steering Committee and will also participate on the Patient Advocate Steering Committee at the National Cancer Institute. Darcy Green is the CEO and Executive Director of Latinas Contra Cancer. As a community leader with nearly 20 years of experience, she has made fighting education inequity, income inequality, and health disparities among her top priorities of focus and work. Darcy has worked as a field representative to former California State Assemblyman Joe Cotto, where she helped to address many public policy issues affecting the residents of San Jose, with a particular emphasis on providing communities access to healthy lifestyle choices and quality public education. And finally, our final speaker will be Dr. Georges Benjamin, the Executive Director of the American Public Health Association, where he has served since 2002. And he has previously served as the Secretary of the Maryland Department of Health and Mental Hygiene in the Cabinet of Governor Paris Glendening from 1999 to 2002. And with that, I'd like to turn us over to Dr. Margaret Kripke.
Good morning, everyone. I've been asked this morning to tell you the story of how I became interested in the subject of environmental cancers and why this topic is important for reducing the incidence of cancer. So as Ense mentioned, my main encounter with environmental carcinogenesis came from my participation as a member of the President's Cancer Panel. And this panel is charged with informing the White House on the status of the war on cancer. And every year it picks a subject and makes a report. And when I was a member of the panel, we decided to look at environmental carcinogenesis. Now, I will have to admit to you that initially I was not very enthusiastic about this topic because the common wisdom in the cancer research community at the time was that only about 6% of all human cancers are caused by chemicals in the environment and the workplace. And so this didn't seem to me to be a very compelling issue. However, the topic had never been addressed by the President's Cancer Panel in its 40 years, and this is a subject of great public interest. And it had received very little attention from the cancer research community. As I'm sure you're aware, most of cancer research today is focused on finding cures, and very little addresses the causes and prevention of cancers. So when we began this, I started with a number of assumptions that I think are pretty commonly held by the public. First of all, I assumed that chemicals would be tested before they're put on the market to the public. Well, since the end of World War II, there have been somewhere between 80 and 100,000 chemicals introduced into our society, some of them in extremely high volumes. And what I found out through this study that it is actually not true that these are tested for their ability to cause cancer before they are sent out to the public. And you can ask, well, why is that? And the answer seems to be that in the United States, we use what's called the reactionary approach to chemical safety, which means that we only regulate after there's evidence of harm. And of course, this contrasts with the precautionary approach used by other Western nations, which requires proof of safety before release to the public. And so in our society, there are really no incentives for developing safer alternatives. And secondly, I assume that things that are known to be cancer-causing agents would be regulated. Well, this turns out also not to be true. For example, there was an agricultural health study done a number of years ago that showed that about 30 pesticides in common use are classified as probable or possible human carcinogens. And the problem here is not just for agricultural workers. These chemicals end up in homes, in gardens, in the food supply, and in the water supply. And in fact, they've been banned for landscaping use in Canada. And so clearly, not all carcinogenic agents are regulated. And of course, the most common recent example of that is the herbicide Roundup, which has recently been shown to be a cancer-causing agent and is in very widespread use by the public. And my third assumption was that when substances are regulated, that these regulations would be enforced somehow. And again, that turns out not to be true. There are many substances that are regulated, but there's no mechanism for enforcing the action of these regulations. So I was really quite astonished by what we learned. And so we wrote in our report that 6% was likely to be a serious underestimate of the contribution of chemicals to cancer incidence, and that this was likely to be a much larger problem than anyone was willing to admit. Well, of course, this was a very unpopular conclusion, particularly in industry. But if I think of what my life was like when I grew up versus what it is now, the differences are so striking. When I grew up, we didn't use an exterminator. We didn't have herbicides. We didn't have no non-stick pans, styrofoam containers, no flame retardant pajamas, few beauty products, and very few household cleaning products. And so it made me wonder, you cannot help but wonder, what is the impact of all of these chemicals on human health? Why have the incidence of childhood cancers and birth defects been increasing for the last 5 decades? And why is it that the onset of puberty has been occurring at progressively younger ages over the last few decades? And why is it that in the current epidemic of breast cancer, more than 80% of the women have no family history of the disease? Could these be related to the ocean of chemicals in which we now live? Now, with all of these important questions needing to be answered, we have to ask, why isn't environmental carcinogenesis a more prominent issue in cancer research? And the answers seem to be that, first of all, it's difficult to study. If one uses classic epidemiology, these studies are expensive and they take a long time, they're hard to control. And it takes a very long time to see the impact of any changes. You'll recall that it took decades before we saw a reduction in lung cancer incidence from a reduction in smoking. And there's actually very, very little federal funding and almost no funding from industry to study this issue. And of course, most funding for cancer research is from these sources. Of course, the ultimate goal of studying environmental carcinogenesis is to prevent cancer. But cancer prevention is also an underappreciated, underfunded area of cancer research, which seems strange considering its potential impact on reducing the burden of cancer. But cancer research, as we've said, is mostly about cures today. Well, obviously, both approaches are necessary. It's impossible to prevent every cancer, and we all want better and less toxic treatments. But reducing the incidence of cancer should also be a priority. Preventing cancer has the potential to affect large numbers of people, including children, and has the added benefits of sparing everyone from the emotional, financial, and physical consequences of cancer treatment. That is why this call to action by the Cancer-Free Economy Network is so important. It lays out the recent growing scientific evidence that chemicals in our environment are important contributors to cancer development, and it provides a specific set of actions that can be taken now to begin to reduce the burden of cancer by decreasing exposures to the toxic substances in our environment. Thank you.
Thank you so much, Dr. Kripke. She asked a few questions. Why have birth defects and some childhood cancers been on the rise? Why is it that 80% or so of breast cancer patients have no family linkages to other forms of similar cancers? And again, on the funding, very little federal funding and hardly any from industry going into prevention techniques and research. and all the various reasons towards the end there of how prevention can benefit every single one of us, especially those in highest risk populations. Thank you so much. We'd like to move now to Jonathan Agan.
Thank you, Ense. Appreciate asking for me to be involved in this and for the Max Secure Foundation to sign on to the joint statement. My personal story and background and how I got involved in this aspect of the fight against cancer is a little bit unique, and so I'll give a little history of my my entree into this world. I don't have a medical background. I don't have any type of prior experience within the world of cancer, other than the fact that I lost my firstborn child to a brain tumor back in 2011. Childhood cancer wasn't my issue. It wasn't something that I focused on. My conception of childhood cancer was what I saw on TV. It was little smiling, bald-headed children who were treated at St. Jude and who stayed at Ronald McDonald House, and they lived happily ever after once they were visited by celebrities while they were undergoing treatment. I was practicing law full-time in Washington, D.C., and I was one of only a handful of folks that I think could probably say they were a happy lawyer. But then my 27-month-old daughter, Alexis, was diagnosed with DIPG, which is essentially a universally fatal tumor. She was given standard treatment at the time, which was radiation therapy. Her mother and I were told that she had 9 to 12 months to live with standard treatment. She fought amazingly for 33 months and passed away in January of 2011. At that point, that's where my story shifts from the practice of law to what I currently do in the childhood cancer world. I started getting more and more involved in the quote unquote advocacy community, and advocacy is a very amorphous term when it comes to cancer, the work that we do. And it was all involved in the standard and normal course of childhood cancer work, trying to fund research into better therapies, better treatments, into the cure. The issue of prevention was not anything that was ever really on my radar screen until a few years ago, when one of our board members and somebody who's been very heavily involved in the childhood cancer prevention initiative, Ann Robertson, started guiding the Max Secure Foundation in the direction of looking at childhood cancer prevention. And that's when I was introduced to David Levine from ASBC and the other members of the collaborative that are involved in the report that's going to be released that Ense mentioned. And that's how I got to meet Ense and so many other amazing folks. At that point, the light bulb really went off, though, in terms of looking at where the greatest gains can be made in childhood cancer, as far as my opinion. If you look at the survival curve for childhood cancer, statistically, about 80% or so of children in the United States that are diagnosed with cancer survive 5 years or greater from diagnosis. It's a phenomenal story. It's a success story. But when you start peeling back the layers of that onion, you start to see how the story isn't as great as it's made out to be. And then when you look at what is happening with the incidence rates of diagnosis of children with cancer in this country, it starts becoming extremely startling on many levels. And so when we were asked to get involved in looking at the issue of prevention, knowing how little discussion was happening within the childhood cancer community overall on the issue, it really became a watershed moment for us as an organization. And moving further in terms of this joint statement, it's it was a no-brainer to sign on to it. You know, for me, there's so many elements of this joint statement and what it stands for that it really was important for us as an organization to join with so many other organizations to bring the conversation out in the open. And so do you want me to go into some of the other components of why we signed on and some of the other questions that were involved?
If you want, maybe another, maybe 2 minutes if you'd like,
Sure.
and then maybe we can circle back during the Q&A if you want to add some more
Sure.
points. Yeah,
I can go on and on and on. It's the lawyer
which
in
is
me.
one, yes,
Um,
which is fine.
So, you know, this issue, there often is a chasm in the childhood cancer community, and I think in disease populations overall, when it comes to looking at treatments and cure versus prevention in the first place. And so what being involved in this statement and this initiative allows us to do within the microcosm of the childhood cancer community is really leverage this discussion in a way that merges the issue of prevention and cure. Oftentimes it's looked at as something that's mutually exclusive. Well, why aren't we focusing on preventing the increase in incidence rates of childhood cancer? Why aren't we focusing more research funding in that avenue so that not only are we bringing the incidence rates of diagnoses down, but one can inform the other, frankly. And that's something that I'm seeking to do in terms of leveraging this discussion within the community to create a broader coalition that really brings the issue of prevention out in the open, and not as a partisan issue and not as an issue of pointing the finger at anybody, but really, as the joint statement does, doing it very simply and doing it in a very non-confrontational manner. Thank you.
Thank you so much, Jonathan, you know, for choosing to share a very personal story on your daughter and the implications to your family, which still continue, no doubt. And Jonathan's story is one of many in this country and beyond. And again, stressing the point, why would we not want to elevate that level of stress and trauma to any child, person, or family if it doesn't have to happen? Jonathan also mentioned the ASBC. Just so everyone knows, that's the American Sustainable Business Council that also is a member of the Cancer-Free Economy Network, and David Levine is the head of that group. And the discussion about treatment and cure versus prevention, and the allowing of the merging of prevention along with the need for treatment, but so much more, that there's not a balance there of attention, funding, capacity. So that is a very helpful set of talking points. Thank you so much, Jonathan. And now I would like to introduce again, Darcy.
Thank you. I'm honored to be in this space with all of you this morning for this exciting launch of our joint statement. Latinas Contra Cancer exists to create equitable and just access to health and the healthcare system for Latinos around issues of cancer and cancer prevention. Yesterday was the anniversary of my grandmother's passing. Her name was Antonia Cuenca. She died on September 16th, 2002. She fought many battles in her life, but her battle with cancer was the only one that she lost. My grandmother worked in the fields of Bakersfield, California, the orchards that preceded Silicon Valley, the canneries of Old San Jose. My mom can recount the stories my grandmother would tell about the planes that would fly overhead, spraying pesticides as she worked. My grandmother often lamented about the chemicals that she and her coworkers were exposed to while working in the fields and the canneries. In fact, while working in the cannery, she became an active union member, fighting for better conditions for herself and for the women she worked with. When they were offered free eye exams, she fought for a trailer to give women mammograms. She understood the importance of this checkup for prevention, and she never missed one. My grandmother did her part. She maintained a healthy weight. She ate a healthy diet. She didn't smoke. She rarely drank. She saw her doctor routinely. She kept up with her screenings. but she was combating a lifetime of increased cancer risk, exposures, environmental injustices that she could not escape with her individual habits or behavior because of where she worked, because of where she lived, and because of the limitations of her income. Of course, we don't know the exact one thing that caused her cancer. She actually was diagnosed twice. But we absolutely do know that the years she spent working in the fields and the orchards and the cannery increased her risk for cancer and likely contributed to her eventual diagnosis. So she was diagnosed with cancer twice, and it eventually spread to her brain. She was given 30 days to live at that point, and she left us in 5. That was 18 years ago. And here we are today, at a time when Latinos, people of color, low-income families, recent immigrants, indigenous communities, and people not unlike my grandmother, and maybe some of your grandmothers, are still facing the same environmental injustices that we as a community have battled for decades. When will it be enough? Toxic chemicals are in our air, in our water, in our food, in our products, where we work, where we live, where our children play. Systemic, pervasive. Generations of known, researched, preventable environmental exposures contributing to also preventable cancer diagnosis, disrupting families and our healthcare system needlessly. We must research and eliminate or reduce these environmental exposures and commit to preventing cancer. Why? Because the inequity in access and inequality in outcomes in cancer treatment and survivorship are staggering. And these disparities disproportionately affect poor people, undocumented people, and people of color. Our cancer burden is so great. The community we serve at Latinas Contra Cancer meets this demographic and is more likely to be uninsured, underinsured, living paycheck to paycheck, and is less likely to work in jobs with paid sick leave or have access to funded government safety nets. The community we serve at LCC battles a cancer diagnosis while also battling the unfair social obstacles and economic turmoil triggered by that diagnosis. A cancer diagnosis should not force you to choose between your best possible health outcomes and paying for rent or feeding your family. But for many of the people we see every day, that is exactly the choice they are forced to make. It is both a moral and economic imperative that we do all we can to prevent cancer. Latinas Contra Cancer signed on to this joint statement because our community demands environmental justice that leads to cancer prevention. We joined this call to action because we all deserve clean air, clean drinking water, clean work sites, clean neighborhoods, and clean schools for our children. We deserve to know when we or our loved ones are being exposed to the chemicals that could increase our cancer risk, and we deserve equitable access to reduction, if not elimination, of our exposure to the toxic chemicals that we know contribute to cancer. Our ethnicity, income, zip code should not drive our toxic exposure or cancer risk. Yet these social determinants do, and they have for generations, from my grandmother to my mother to me. And ya basta, enough is enough. At LCC, we can see a world free of cancer and the toxic chemicals that cause cancer. If you can see that world too, if that's the world you want to live in with us, it's urgent that you support this joint statement. Our efforts to eliminate the environmental contributors to cancer, that you advocate for transformative investment in cancer prevention, and that you do this work through the lens of health equity for the communities who are now and who always have been historically disproportionately affected by cancer. Thank you for having us here today.
Thank you so much, Darcy. The generational impacts are also very clear in families all through this this country. And thank you for lifting up the memory and honor and leadership and energy of your grandmother. You also spoke about, the neighborhoods and the agricultural neighborhoods and communities in around the San Jose, California area. And, many of our colleagues and friends and many of our family members know that still to this day, that these atrocities are still happening among some of the lowest income, the most overburdened populations, the essential worker populations, and it's not okay that these cycles are still happening. You also talked about the systemic, pervasive, and preventable exposures that we are talking about here in reducing and eliminating, in some cases, the potential threat to cancer. So thank you. And our last speaker is Dr. Georges Benjamin.
Thank you, Insay. Everyone, I'm an internist and an emergency physician. And, one of the things I learned practicing emergency medicine in particular was the importance of prevention. The fact that a number of people would come into hospital emergency departments with things that were certainly preventable. I remember that my first public health job was in 1990 as the health commissioner of Washington, D.C. And I remember getting a call one day that we had a cancer cluster amongst our sanitary workers in the city. And so we did what most public health departments do. We go in and we begin looking at what some of the root causes may be for that cluster and try to understand whether the cluster was related to the working conditions at that plant, or even if the cluster was related to anything that had to do with their job. Interestingly enough, what we discovered was that there had been an enormous exposure of those workers to simple gasoline. They used gasoline for everything, not just to fill their cars so they could drive, but they actually were using this amazing fossil fuel because it's an amazing solvent to clean everything, to clean their trucks, to clean off their hands before they went home. The use of the solvent, the use of this gasoline was prevalent in their everyday lives. And the more interesting thing was they did not know that there was a risk to using this cancer-causing chemical in their daily lives. The education for that workforce was astounding. And so, of course, we looked into it. And the good news is we actually did a medical evaluation of every worker in that garage. And we did not find any new cases that we during that period of time. And of course, there's like many small cancer clusters, we were never really able to say for sure that it was related to their exposure at work. Nonetheless, that's the good news. The bad news is, of course, that we don't know what the long-term implications for that population is. Of course, that population did not get studied in a long-term study. So I do not know if 30 years later, there were other cancers among that population. But we know that the odds are pretty high that that's the case. Of course, cancer is the second leading cause of death in our country. And a lot of it is preventable. And certainly a lot can be identified by early screening and detection. I remember practicing in the emergency department where a lady came in who was elderly and had a mask on her chest. It was a breast mask. She came in with the chief diagnosis of chest pain. And of course, an older person comes in the ER with chest pain. The first thing you do is you put them on oxygen, and the nurses automatically go get the EKG machine to make sure that they're not having a heart attack. So as we're putting the EKG monitors on this patient, we noticed that she had a breast mass. And when you pressed on that mass, that was the pain that she had. And you said, how could anyone have such an evolving mass on their chest and not have been screened? Well, this was obviously someone who did not have access to healthcare and did not have access to the enormous screening services that we have for breast cancer. And then finally, fast forwarding to my time here at the American Public Health Association, where we have been battling the ravages of environmental pollution in our nation, trying to make sure that people know that the water is safe to drink and the air is safe to breathe. And the challenges that we have when we don't have good environmental regulation. In fact, our nation quite recently has pulled back on some of these regulations, which absolutely cause a range of health threats, from cardiovascular disease to lung disease and cancer. So the American Public Health Association is on this statement because we believe very strongly in prevention. And we believe that whether it's the education that's necessary for the sanitary workers in my first public health job to the experience that I had as an emergency physician to the regulatory challenges that we now have in our nation to really do this right, to make sure that we once and for all put in place techniques and skills and programs so that people don't have to have diseases that are preventable. And I would encourage people to do several things. Number one, get to know where their poison control centers are. Get to know the phone number of your poison control center so that you can ask questions of them. They're there as a public resource to educate you about toxic exposure. Secondly, inventory what's in your house. Don't assume that everything that's in your house is safe. As Margaret said, you know, a lot of this stuff has not been tested. It's just been put on the market. And then if suddenly people get sick, then we begin to look into it. And that is not the precautionary principle. We can practice the precautionary principle at home by looking at what we're bringing into our homes and doing our own investigations and then reporting that and then being involved in the advocacy efforts to get these things taken off the market. And then I think it's important to understand to engage with organizations that are involved in environmental advocacy and be part of this army of people that we have that want to protect our communities. Our first and best protection is towards prevention is awareness. And I encourage the broad public to become aware of the fact that we're at risk from many of the chemicals and things that we bring into our homes every day. And this statement that we have is a call to arms for every person in our country. Insay, I'll turn it back over to you.
Thank you so much. As a longstanding member, and I know we have a lot of APHA, American Public Health Association members on this call also, we continue to be so appreciative for the leadership of you, Dr. Benjamin, and the APHA. You reminded us all that cancer is the second leading cause of death in the US. And when I was going to school in public health, sadly, I feel so much attention was placed on mortality and where we funded things and where attention went and where capacity and training went. I don't know if we're out of that just yet, but that was unfortunately something that I never liked. I personally don't think there's any certain amount that you can put on one class of individual or one human life that should add value or lessen the value. We should be preventing when we can prevent, when we know better. Maybe decades ago, we could have claimed ignorance or that we didn't know or the science wasn't there. The science continues to emerge. So thank you for reminding us that in order to really turn the tide on this and to really get to the type of systemic change that is necessary, we have to all get involved. We as individuals, we in our places of our influence in our communities and with our numbers collectively. So find an organization that you would like to align, the Cancer-Free Economy Network, any of these groups here, any of the signatory organizations, we could all use some support and numbers. There will be some specific strategies by which this joint statement will be utilized to get in front of key stakeholders, key research institutions, key policy leaders at the federal level and at the state level, and certainly various advocate efforts. We also just want to remind us all that the type of prevention at times that's talked about as far as efforts to reduce smoking and to think about your diet and to think about your physical activity, of course that's important, but this discussion here goes well beyond that. I think, Darcy, you spoke to that. When you're doing all the right things, if you will, and you still are in harm's way and you cannot avoid it, and it's not through your occupational, it could be, through your occupational setting or what's in your home environment that you're exposed to on a long-term basis, or your learning environments. Childcare facilities and schools are not getting enough attention. And right now during this pandemic, there's a lot of, understanding that we need to do better as far as making sure our learning environments are conducive for children, for their learning, but also their health and safety. So I will stop there, just seeing if we have any more questions come in. Just a lot of gratitude and thanks coming in the chat box for our presenters. We definitely don't want to hold anyone up, but this is just final call. If there's any questions, just please write those in the chat box or the Q&A box. And I'll just stress again while we're waiting one more minute on that advocacy. And Dr. Benjamin, you mentioned the rollbacks. Many of these groups and many of our groups collectively have been working for basic public health provisions, protection of our air quality, protection of our water and drinking, protection of our food, and making sure that we have healthy, safe, and even access to food, which many communities do not. But when you're rolling back basic public health provisions, we have some work to do. We had some work to do before, but we definitely have some work to do. And we need to acknowledge that these basic routes of exposures and places where people are spending a lot of their time are a big part of our challenge. So we have certainly enough to keep us busy. All right, well, I'm not seeing any more questions. I did put in the chat box where everyone can find the joint statement. It is on the Cancer Free Economy Network site. There's also a variety of different social media marketing messages that will be sent around, so you can be following those and sharing those. And we do encourage you to please share this widely. Again, this is a call to action, a call to arms, if you will. We need to make sure that the reality of the science does not just stop here, but that is actually part of the motivation and the movement towards action that truly is protective of our communities as they're so deserving, our current and certainly our future generations. And I'm sorry, we have one question here. Oh, and they asked if we can send it one more time. So I'll just read off the website real quick. You can find it at the Cancer Free Economy Network website, and that is www.cancerfreeeconomy.org/joint-statement. Okay, and with that, I'd like to thank our esteemed panelists. Thank you so much for your leadership, your advocacy, your energy, and for your time. We really appreciate you all very much. And everyone enjoy your day, and we will hopefully learn and hear more from you for your support of this joint statement and related work coming out. Thank you so much.
Thank you.
Bye-bye.